Hello, my name is V Rodriguez. I'm here to do my National Patient Safety Go presentation with Jessica and Larry that are here to help me out. My focus is on preventing infection. I'm focusing on National Patient Safety Go 070401, which is use proven guidelines to prevent infection of the blood from central lines. Healthcare-associated infections are a major source of morbidity and mortality, despite often being preventable. Most hospital-acquired infections are associated with invasive devices and occurrences of care units. Of an estimated 99,000 hospital-acquired infection-related deaths per year, bloodstream infections lead to an estimated 31,000 deaths per year, with a mean attributable cost of $18,000 per central line infection. To prevent central line infections is important. What I've learned is using guidelines to prevent hospital-acquired infections is essential in providing safe patient care. The goal of hospitals is to improve the health of our patients. This safety goal is important because it will improve the care of patients with central venous access, and I've learned compliance with evidence-based guidelines will decrease the number of casualties in the ICU. Some of the guidelines: the IHI central line bundle consists of 5 interventions. Number 1 is hand hygiene, maximum barrier precautions, chlorhexidine skin antisepsis, optimal catheter site selection with avoidance of the femoral vein for central venous access in adult patients, and daily review of the line necessity with prompt removal of unnecessary lines. In a national study that examines real-world practices of monitoring and implementing central line bundles, it was very interesting to see that it showed that although there were many hospitals that used the bundle, that only 38% of these monitored the bundle and implemented full compliance or reported full compliance with the bundle. This is significant because the study found that simply having a bundle doesn't necessarily mean that there's a lower infection rate. What this study showed is that when an ICU had a bundle policy, monitored in compliance with it, and had a 95% or greater compliance rate, then there was a decrease. So what this showed is that just having a policy or just having a bundle, knowledge of a bundle, isn't enough. You've got to actually use the bundle 95% or greater to see an increase. I did a study of an LTAC also. The LTAC's bundle compliance consisted of central catheter dressings was intact for 100% occlusive. A date was present on the dressing. Initials were present on the dressing. Non-gauze dressings were changed within 7 days or gauze within 48 hours. Daily assessments of the dressing sites were made by a nurse or catheter team. A sterile cap was in place and all intravenous stopcock ports, and a chlorhexidine sponge or dressing was in place at the catheter insertion site. The result from using this bundle in the LTAC showed that the application of the bundle resulted in a significant and sustained reduction in casualty rate in LTACs for 14 months. So the results encourage the development and implementation of similar bundles as effective strategies for reduction in central line venous infections. So along with the challenges, along with wanting to improve, there's some challenges and solutions. The Government Accountability Office study identified 3 key challenges that affected hospital efforts to implement evidence-based patient safety practices. Some of these challenges were obtaining data to identify adverse events in their own hospitals, determining which patient safety practices should be implemented, and ensuring that staff consistently implemented the practices over time. These were the challenges. Hospital officials stated that to overcome these challenges and implement patient safety practices, these hospitals needed to dedicate resources to patient safety efforts, including staff with patient safety experience, and systematically involve hospital management and staff, including physicians, in patient safety efforts. So it's important. It's not just one person's job, it's everybody's job. And the hospital has to have a buy-in, not only from one individual, but it has to be a staff, and we have to have physician buy-in also. So compliance is essential. Use proven guidelines to prevent infection of blood from central lines. The keys to success are these. 1, we got to dedicate resources to patient safety efforts. Number 2, implement an evidence-based guidance and maintain a greater than 95% compliance rate, and this would decrease collapsing rates. So what I've learned from this presentation is simply this. that the hospital needs to find an evidence-based bundle and ensure that the compliance rate for this bundle is at least 95%. This is now a national patient safety goal by the Joint Commission, so it's going to be imperative for hospitals to comply with it and take it seriously. Any questions? No. All right, thank you.